Hi, this is Dr. Srimukhi. I'm a consultant pediatrician and neonatologist at Vijayawada, Andhra Pradesh. Uh, I am available on Baby Chakra for any a consultation or any child health tips, and I'm also handle a Instagram account where I am available for online consultations between 4 to 5 p.m. I practice at my hometown, Vijayawada. I do tertiary, at a tertiary care hospital. We handle all neonatal ICU and pediatric ICU cases here. So now the boom is regarding COVID vaccines. So COVID vaccines in kids. All the adults are mostly protected with COVID vaccination, but what about the kids? That is the hot topic now, and I'm going to discuss to you about COVID vaccination in children. So the COVID vaccines, which are available in India and which are approved by the DCIG at present are Zycovid and Covaxin. Covaxin is available for 2 to 18 years, is approved for 2 to 18 years age group, and Zycovid is approved for 12 to 18 years age group. These are the two vaccines which are available in India. But there is still time for the government to give proper guidelines for how to start the use of these vaccines in India in children. So the trials have been completed by Covaxin and Zycovid, which have been approved that they can be given from 2 to 18 years age group. Covaxin and Zycovid has been approved and tested in trials for children between 12 to 18 years. So many parents would be wondering, what vaccine should I give to my child, and is it emergency that I have to give COVID vaccine to my child immediately? Firstly, let us see know the severity of COVID in children in the past three waves. So, in the past three waves, the COVID has not affected the children very severely. There were only 1 to 2% of children were affected severely or with complications like multi-system inflammatory syndrome. And these children were only 1 to 2% of the children had these symptoms and were admitted to the hospital. All the other children had mild to asymptomatic diseases. So, if COVID is not severe in children, should we vaccinate our children with COVID vaccine? Is the question of most of the mothers. So, this vaccination should be done and is mandatory. Why is it mandatory? Why is it necessary? I'll tell you 2 points. First thing is, like, it helps to prevent transmission of infection from children to adults and from adults to children. So in this way, it helps in breaking the chain of the transmission. So this way, it is advised to give vaccination in children, COVID vaccination in children. Second thing is, there are children who have been affected severely. Like I have told you, 1 to 2% of kids have been affected severely. So this vaccination will help us in preventing the severity of the disease in children. So in these two ways, these COVID vaccines are very much helpful in children. So children need to be vaccinated by COVID vaccine, which is available in India. So when are these vaccines coming up? Mostly these vaccines will be coming up in the next few weeks, like 2 to 3 weeks. They'll be approved by the government and they'll release proper guidelines and stage-wise approach when to give vaccine to whom. Mostly, firstly, the vaccination will be given to the children with comorbidities like heart disease, children having any kidney disease, children having asthma. All these children will be first vaccinated, and later in the phase, other children will also be vaccinated. So, should I send my child to the school without vaccination or with vaccination? Is the most common question asked in the OPD by mothers to us. So, the answer for this question would be, if the school is following proper guidelines, like the school premises are following all the COVID regulations, and like wearing the mask, maintaining proper sanitation, and maintaining social distancing. And if all the staff and teachers are vaccinated with COVID vaccines, and if the parents are sensible enough and vaccinated, then there is no problem with sending children to schools even without COVID vaccine. I think parents should wait patiently for the COVID vaccine to get approved and let it come. And whenever it is available, please vaccinate your kids with COVID vaccine, and please send them to school as soon as possible. So, what is the efficacy of the COVID vaccine? That is what everyone is asking about. So, the efficacy of the COVID vaccine is same as in the adults, like 75 to 80%. It has not changed, and it is the same in children also. And what about the side effects with COVID vaccine? Generally, the same side effects as in the adults have been seen with the children also. They are very minor side effects like pain at the site of the injection, fever, thoda sa bukar hona, or kasi. All these are the mild side effects which are seen with the COVID vaccine. There are no major side effects which are seen with the COVID vaccine. But whenever you're being vaccinated, go to a proper center, a proper vaccination center, or a pediatrician clinic where they have emergency adverse reaction approach medicines like adrenaline, steroids, everything which are readily available. You have to choose a center where all the emergency things are available and then vaccinate your child. So these are the things about the COVID vaccines which are available in India regarding the Covaxin and the Zycovid. And if you have any doubts regarding the COVID vaccines and regarding COVID vaccination in children, you can ask me in live. So Aishi, yeah, the first question is, are the COVID-19 vaccines safe and effective? Yeah, the Covaxin and Zycovid, the trials have been completed. Even the phase 3 trials have been completed, and they have shown that this COVID vaccines are safe and effective in children. So the efficacy is around 75 to 80%, same as in the adults. And safety wise, they have very minor side effects like pain at the site, fever and mild body pains and all. Other than that, there are no major side effects reported in the trial. And there was also a trial which was done in AIMS, New Delhi, and, which included the almost 523 children, and there were no major side effects reported in that study also. So I can conclude that it is a very safe and effective vaccine. Yeah, the second question is, I have heard there are variants of virus that causes COVID-19. What does this mean? Okay, so there is this is like a microbiology question. Like there's one virus which has a mutant. It can mutate. So that variant can change to another. Like now we are dealing with beta, delta. We have given the names to that COVID virus. Okay, so the behavior of each variant of the virus may vary. So that is the difference. Like the Delta virus may affect the respiratory system only and have symptoms like cold, cough, and fever. but some other variant which is coming might also affect the gastrointestinal symptoms and can cause diarrhea and the other things. So the variant is always the difference on their, there is a difference in their action. That is the meaning of the variants. Are any of these new, the third question is, are any of these new COVID-19 variants more dangerous for children? According to the recent studies, the probability of these new COVID variants being very dangerous in children is very less. That is actually very happy to say that they are very less dangerous to children. The new variants are less dangerous to children because the previous variants are also didn't show any severe symptoms in children. Luckily, they have identified that because it is not, COVID is not very serious in children because the spikes in the COVID, these spikes get attached to the AC receptors in the nose, throat, and lungs of our of children. So in the lungs and in the lungs, nose, and pharynx, there are some receptors called AC receptors. These receptors are very less in children less than 10 years of age group. That is why this COVID is not being attached to more to that receptors, and that is why the severity of COVID is less. But the recent studies have also shown that the new variants might not be that much dangerous to children. But in 10 to 18 years age group, yes, there is chances for severe disease in children also. The fourth question is, does COVID-19 affect children? Yes, definitely. COVID-19 can affect children, but there are four types of COVID-19 presentations, like asymptomatic presentation, mild presentation, moderate presentation, severe presentation. Like in asymptomatic, most of the children, 60% of the children are asymptomatic. That means they are affected with COVID-19, but they do not have any symptoms. Uh, Other 30% are having mild symptoms like fever, cold, cough. These are or throat pain. These are the mild symptoms which are present in COVID-19 affected children. So 94% of the children are either asymptomatic or come into the mild symptoms category. Only the remaining 6% of children are in moderate and severe stage. Only the children with severe stage or MISC, which is a rare complication of COVID-19, late complication, actually it can be called late or rare complication of COVID-19. This is affecting 1 to 2% of children, and this is slightly serious condition which requires an ICU stay in children. So the other question is, what should I do if my child has symptoms of COVID-19? Yes, if your child has symptoms of COVID-19 and I feel you need to approach to a pediatrician because every child is different and every child behaves differently. They have a previous history. They have some they have some personal problems. So we have to treat every child differently. So every child's history is important. So approach a pediatrician, either do an online consult if it is a mild and asymptomatic. And if you feel the symptoms have been increasing, you have to go to the hospital directly. So if there are very mild symptoms like fever, cold, cough, mostly the pediatrician would recommend you the symptomatic treatment like medicine for fever, medicine for cold, and some immunity boosters. If the symptoms are severe, they might be requiring IV treatments and all. The next question is, can pregnant women pass COVID-19 to unborn children? Many studies have been done and they have shown that pregnant women do not pass COVID-19 to unborn children. That is, vertical transmission from the mother to the baby has not been reported till date. The next question is it safe for a mother to breastfeed if she is infected with COVID-19? Yes, it's absolutely safe if you follow three W's. One is wear a mask. The mask which the mother should wear should be an N95 or double mask with a cloth and surgical mask. So wear a mask is the first W. Second W is wipe the surfaces. Wipe the surfaces means mother should wipe the surfaces wherever she have coughed or sneezed. So if the mother have sneezed on the breast, so she have to clean it before giving the feed to the baby. And if the mother have coughed on the bottle or anything which is being served to the baby, then the mother have to clean that before giving it to the baby. And the third thing is wash your hands. So follow hand hygiene, which helps in preventing the disease from mother to the baby. So it is very safe to breastfeed the baby. Breast milk doesn't transmit COVID-19, but mother have to follow three W's. The three W's being wear a mask, wipe the surfaces, wash the hands. So the next question would be, what COVID-19 vaccine has been approved for kids? Yeah, this is the vaccine. There are two vaccines which are available in India. One is Zycovid. This is approved by Zydus Cadila company. This is approved for 12 to 18-year-old children only. And there is another vaccine which has been recently approved. That is Covaxin, which most of the adults have been vaccinated with. Covaxin by Bharat Biotech is approved from 2 to 18-year-old kids, but yet the government has to release the guidelines and permissions for the vaccination. That might release in the next week or so. So, yeah, the next question is, if children don't frequently experience severe illness with COVID-19, why do they need a COVID vaccine? This is a very nice question, and I've also answered in the talk also. One is, I have told you that 1 to 2% of children have severe disease. So we don't know which child is going to get the severe disease. So that is why we need vaccination for COVID in children also. And the other thing is, if the adults are all vaccinated, the children are the only source host left for the virus. That is, the transmission will increase. So to break that transmission chain, we need to vaccinate our kids. The third thing is, this also helps in preventing severe disease in adults, because if the children are vaccinated, the transmission rate is decreasing. So the severe disease in children, in adults will also decrease. The mortality rates will decrease. So for the herd immunity to achieve, so these are the third reasons why we should vaccinate our children with COVID-19. Next question is, what can my child do after getting a COVID-19 vaccine? Yeah, I think, what can my child do after getting a COVID-19 vaccine? Uh, I The child can follow regular schedules. The child can go to school. The child can eat and drink the normal food and everything. I didn't understand the question, but one thing which the child and the parents have to be careful is to observe for the side effects. The most side effects are very minor. The minor side effects like fever, pain at the site of the injection, and body pains. So for that, I think you can ask a prescription from a pediatrician for a paracetamol, and that will take care of these three symptoms. The next question is, how soon can a child get a COVID-19 vaccine, before or after getting another vaccine? Okay. Any two vaccines, it's better to have a 28-day gap, or take the vaccine on the same day as previous. I mean, it can be combined with some vaccines, but if there is one vaccine taken already, then you need at least a 28 days of gap. I think I've answered that question. And the next question is, okay. So I think we are done with the questions. So do not hesitate to vaccinate your children. Okay. So that completes the question and answer session. These are the sessions, and I would like to conclude by saying, do not hesitate to vaccinate your children, and vaccinating your children can prevent from the severe disease of COVID-19 and also helps in stop transmission of COVID-19 virus. So follow the government protocols and get vaccinated in a proper center under a medical guidance and follow your pediatrician's advice. So thank you for the beautiful session organized by Baby Chakra. Please download the Baby Chakra app and do check out their videos.